So one thing which we tell all patients is that everyone's cancer is different and we have to tailor the treatment to that particular patient or to their specific cancer. All ladies get a regular examination done by a doctor after 35 years of age. Do breast self-examination. There are certain risk factors and there are risk factors for breast cancer as well. And there are certain non-modifiable risk factors which we cannot change.
Not all angels have wings. Some of them have stethoscopes. We are about to interact with one such angel, Dr. Rohan Khandelwal. Dr. Rohan is a talented breast cancer surgeon based in Gurgaon. He specializes in the management of benign and cancerous breast disorders. He has handled more than 500 breast cancer surgeries and has over 17 years of experience in his hand. Dr. Rohan also leads the Breast Center, a patient focused and performance driven center. The Breast Center is the only dedicated unit in North India offering comprehensive breast health services. He is also the head of the medical affairs at Curofy, a doctors' networking app which is a digital platform for doctors to communicate. He is the editor in chief for the New Indian Journal of Surgery and Journal of Young Medical Researcher. Dr. Rohan also has a YouTube channel through which he spreads awareness with the help of videos. We feel delighted and overwhelmed to have you here with us today, sir. Over to you.
Thank you, Padma. It's an honor to be interacting with all of you, and thank you for the very kind introduction. Thank you.
Yes, sir. So, sir, uh, now we have a few questions to ask you regarding your career, your work, and regarding breast cancer. So, can we start, sir?
Absolutely.
Yes, sir. So, the first question is, everyone knows that cancer is very dangerous and it would be really shocking for one to know that they have breast cancer. So, how do you let your patients know that they have breast cancer? Do you give them assurance or comfort of any sort? Is there a specific way or technique to inform them about the cancer that they have to prepare themselves mentally for the battle?
Yeah, so you rightly said it, this word itself, is very scary. And whenever you take this word in front of any patient, um, I can imagine how scared and anxious they might be. So there are certain rules which I've set for myself. Number one, I never tell the diagnosis over the phone. It's always in person that I share the diagnosis. And when they come to my chamber, I try to make them feel comfortable. First, talk about things other than their problem. I make them feel comfortable, and then I disclose the diagnosis. Of course, it's very important that when I tell the diagnosis, it's important to listen to them and to give them time to express their emotions as well. In my chamber, I do keep a glass of water as well for them because at that time they might require it, and also just listen to them. That's very important. After telling the diagnosis, I stay quiet for some time and just give them time to express their emotions. So those are some of the things which I do when I'm about to disclose the diagnosis of cancer to a patient. Of course, depending on their stage, I tell them what the prognosis of their cancer is, how well, are they going to do. One thing which is very certain is that I don't hide facts from them. So whatever are the facts, I do convey to them, but one fact at a time. I don't burden them with all the facts because once they've just been told about the diagnosis of cancer, it's very difficult for them to comprehend 10 other facts at that time. So it's one by one we reveal the diagnosis and what their journey is going to be like and how are they going to fare with the diagnosis.
Yes, sir. Mental health is really important during these times.
Right.
Okay, sir. Next question. The treatment for breast cancer is not the same for everyone. It differs from person to person. So, what are the factors that you consider, or what are the factors that determine the type of treatment that should be given?
So, one thing which we tell all patients is that everyone's cancer is different, and we have to tailor the treatment to that particular patient or to their specific cancer. So, treatment for everyone can be slightly different. Of course, the four things in breast cancer are surgery, chemotherapy, radiotherapy, and hormonal therapy. So, not all patients require all four therapies. Some of them require just two, some might require just one, some might require all four. So, this depends on the stage of the disease, how much has the cancer spread, and what is the biology of the cancer, how is the cancer behaving. So, based on these two factors, we determine what all therapies will the patient require and whether the patient requires chemotherapy first or surgery first is also dependent on these factors.
Yes, sir. It is really specific according to every person. So, let's move on to the next question. What are the typical side effects for the treatments that you just mentioned, and how to physically and mentally cope up with them, sir?
If breast cancer is detected early, then patients might not require chemotherapy. So, that is something which patients should understand that early detection holds the key to avoiding things like chemotherapy. Now, with surgery, breast cancer surgery is very safe and it is usually a single day admission. The patient comes in the morning, we discharge the patient the next day. And barring mild to moderate pain, there are no major side effects of breast cancer surgery. In a small group of patients, they can develop swelling of the arm, which we call lymphedema. So, that is in less than 2% patients. Chemotherapy, yes, chemotherapy is associated with some amount of weakness. There is hair loss, but it is reversible. Hair comes back once chemotherapy is stopped. There can be other side effects like nausea, some bit of vomiting, but all there are very good medicines these days which are available to manage these side effects. So even if a patient is about to undergo chemotherapy, they shouldn't be scared of it. Third is radiotherapy. Radiotherapy is radiation therapy, very well tolerated, except for some burning sensation, some redness over the skin when radiation is given. And hormonal therapy is in the form of tablets, and again, it is very well tolerated, hardly any side effects.
Yes, sir. So, now let's go to the next question. Will breast cancer treatment affect fertility in women?
Yes, that's a very good question. So nowadays, I'm seeing a lot of ladies who are very young developing breast cancer. So my youngest patient now is 23 years of age, and I have at least 4 or 5 patients who are currently undergoing treatment who are between the age group of 26 to 31. Now, some of them are unmarried, and yes, this is one of the questions which they do ask that will breast cancer treatment affect their fertility? So, the chemotherapy which we give, yes, that affects the ovaries and in turn affects the fertility as well. So, every time a breast cancer patient is diagnosed, we do counsel the patient for fertility preservation where we can save the eggs of the lady or we can create embryos, that means fuse them with the sperm of the male partner as well, and these can be stored and they can be used later on once their breast cancer treatment is over, and by this method they can have a biological child. So yes, chemotherapy does affect it, but there are methods which are available to preserve fertility as well.
Yes, sir. It is good to know that there is a solution for this too. So, the next question is, Breast cancer occurs in all kinds of people, irrespective of gender. But it is a known truth that females have more probability to get breast cancer when compared to others. Why is that so, sir?
So that's the hormonal and the genetic makeup is such that the hormones which drive this breast cancer, which give rise to breast cancer, are more abundantly present in women, and also breasts are more developed in women, which is why breast cancer predominantly occurs in women. It can occur in males as well. It is 1% incidence. So if I see 100 patients of breast cancer, 99 would be females, one might be a male breast cancer as well.
Yes, sir. Thank you for clarifying that. So, the next question is, can breast cancer be prevented?
So, for every human disease, there are certain risk factors, and there are risk factors for breast cancer as well. And there are certain non modifiable risk factors which we cannot change, like increasing age, like the family history of cancer, like at what age do the periods start or at what age do the periods stop. These are things which are beyond our control. But there are certain modifiable risk factors as well, like being overweight puts a lady at a higher risk of breast cancer. Smoking and drinking puts them at a higher risk of breast cancer, right? So these are things which can be controlled by the person. And if these three things are controlled, the weight, no smoking, no drinking, then a lady can reduce her chance of getting breast cancer by almost 30%. So, yes, to a certain extent, you can reduce your risk. You can't make it zero, but by living a healthy lifestyle, you can surely reduce the risk.
Yes, sir. Okay, sir. So, the next question is, how could you tell the general contribution of the breast center at CK Bella Hospital? How has it contributed to the general cause and also some exceptional ones?
So, look, up till say 7 or 8, 10 years back, there wasn't a specific branch called breast surgery. This is a very recent branch which has come up, and there are very few surgeons who are only practicing breast cancer surgery, right? There are just a few of us who are just dedicated towards this branch. Now, the purpose of starting the breast center was basically to offer standard of care, good quality services in both benign, that is non cancerous, and cancerous breast conditions to patients all across the country. So we cater to patients from all across India and also international patients who come to us with their breast problems. And with the state of the art facilities, we are able to help them out.
It's a really good initiative, sir. Now let's go to the next question. You have treated many patients. Each one must have given you a unique experience. Can you tell us one inspiring journey of a patient that you still remember?
Well, each patient, I remember their journey, and I don't forget my patients. In fact, we have a support group, and we meet every month. So my new patients, my old patients, all of us get together in an informal setting, and we discuss our journeys. We discuss how life is treating us. So it's always memorable to be in touch with them. Of course, the two cases which are very dear to me are my youngest patient and my oldest patient. Right, my oldest patient is a 93-year-old lady whom I operated, and she's still doing fine. And every time she comes for a follow-up visit, she will get homemade tea and cookies for me, and we both have them in my OPD chamber whenever she comes. My youngest patient is also very special because to see her at such a young age battling the disease and how well she's recovered is also very heartening for me to see. So she was unmarried, and she went through 1 year of therapy, didn't leave her job, kept on working. And now she's an inspiration for others. She's the first person who always speaks in our support group, and she inspires hundreds of other patients and encourages them to take the entire treatment. So, like I said, all patients are very special, but these are two patients, whom I cannot forget ever.
Yes, sir. Every fighter is inspiring. So being a doctor is very tiring physically as well as mentally. In your career, you'd have experienced both successes and losses. How do you feel after a success, and how hard it is to cope up with this loss as a surgeon, sir?
So those are very good questions. So, our training, like the training of any officer, you people also know that it's very hard. Similarly, for medical graduates also, the training is very rigorous. And we are exposed to, losses very early in our medical career. So, certain things, like my parents are also doctors, so they always used to tell me that, whenever you have a loss or whenever you lose a patient, you of course feel bad for some time, but you need to come out of it because you need to help out other patients. You can't let that affect your performance for the next patient. So, yes, like I told you, all breast cancer patients are very special for me. So, if any of them does lose their life, I reach out to the family, spend time with them. um, but when I'm treating my next patient, I forget about that and think about giving my best to the next patient.
Yes, sir.
Success
Though it is.
is Yes. So success, again, we don't let success get to our head, because, medical field is a great leveler. You might be on a high at one point of time, and you might hit a low within seconds. So, you need to be level-headed, and you need to take both the things in your stride and give your best shot.
Yes, sir. It is hard, but we have to move on. So this brings up to the last question. To all the people that are watching, what steps would you recommend to reduce the risk of getting affected by breast cancer, sir?
So, like I've already told you, that maintain a healthy lifestyle, regular exercise, maintaining your weight, avoid smoking, avoid alcohol consumption. These are some tips to, in general, not only breast cancer, this cuts down the risk of at least 10 other cancers. Also, to all ladies, get a regular examination done by a doctor after 35 years of age. Do breast self examination, and that is very important. Every month a lady should carry out breast self examination after 20-25 years of age. There is a detailed video on my YouTube channel where my nurse has demonstrated the correct technique of doing this, and they can follow that, and that would be helpful. Also, after 40 years of age, every year getting a mammogram. A mammogram is an X-ray of the breast, and that helps in picking up breast cancers early as well. So those would be the tips which I would like to share with all the users.
Yes, sir. Sure, sir. We will follow them. So now we have come to the end of the guest lecture. Spot the cancer you can see when it's easiest to treat. We will surely remember your emphasis on early detection and encourage our friends and families to follow it too, sir. We are very grateful for getting this opportunity to interact with you and learn more about breast cancer. Thank you for spending your time with us amidst your busy schedule and answering all our questions patiently, sir. It really means a lot to us.
Thank you very much for the opportunity. The pleasure is all mine, and I hope I can, bring about some difference in a person's life. If people learn about breast cancer, and if this helps in creating awareness, I think so. I've achieved my goal.
You really
Thank you.
made a difference, sir.
Hmm.
We
Thank
would
you.
also like to thank all the viewers for joining us. We hope it was informative. We encourage you all to keep spreading awareness. Thank you all once again, and thank you, Dr. Rohan Kandalwar, sir.
Thank you. Thank you.